Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic, and today I'm going to talk about feline leukemia. Feline leukemia is a viral disease in cats. It isn't contagious to dogs or humans. If a cat is exposed to feline leukemia, he has three options. The first, if he's lucky, he will clear the virus and be fine. The second is he will stay sick and have the virus in his bloodstream for the rest of his life. Or third, he will become latently infected, meaning the virus will vanish from his bloodstream and will hide in his bone marrow like a deep-cover spy, making it hard for veterinarians to detect and waiting for a stressful event to launch itself back into the bloodstream and make him sick again later. Like any good spy, feline leukemia can appear in a variety of guises. It can act similar to the human immunodeficiency virus and cause immunosuppression in the cat, leaving him unable to fight off other diseases. It can hide itself in his genetic material, causing damage that leads to the cancer lymphoma. Finally, it can cause feline leukemia, as well as other disorders such as anemia. Because feline leukemia can cause so many other diseases, there aren't any specific symptoms for this disease. It just depends on what form it takes. But general signs may include weight loss, depression, and poor hair growth. Like spies making a live drop, FELV, or feline leukemia, spreads when a cat is in close contact with infected cats. Infected mother cats can pass it on to their kittens before or after birth. Cats can spread it by grooming each other, biting each other, and sharing food, water bowls, and litter boxes. Whenever you get a new cat, have her tested for feline leukemia as soon as possible and definitely before you expose her to your other cats. There is a blood test that veterinarians can run in the clinic. If your cat slips outside and may have been exposed to feline leukemia, she should be tested 28 days after exposure. If the clinic test is positive, a blood sample can be sent to an outside lab for a second confirmatory test. If you have cats that go outside, there is a feline leukemia vaccine. But it is like standing under a tree in a rainstorm. It's better than nothing, but you may still get wet. Not all cats vaccinated against feline leukemia develop protection from the disease. Additionally, there is a slight chance 1 in every 5,000 to 10,000 vaccinations per year that the vaccine may cause a cancer called sarcoma at the site of injection. This is why veterinarians only vaccinate cats for feline leukemia that are at risk for exposure. Also, often the feline leukemia vaccine is given in the cat's left hind leg, so that if a sarcoma develops, the leg can be amputated. Personally, I vote for preventing the exposure instead. Cats with feline leukemia live an average of 3 years after contracting the disease. Although some may live symptom-free for longer, it's difficult to predict for an individual cat. There currently, in 2015, is no cure for the disease. There are some antiviral and some immunomodulating drugs that have been studied, but none have been shown to be effective in curing the virus. Feline leukemia is an incurable disease, spread between cats in close contact, that may be prevented by a combination of testing, vaccinating, and avoiding exposure.